compound will continue to soften after it's removed from the heat source. It is an insulating material, so if you heat it until it's really runny, it will continue to soften and be difficult to work with. Apply compound to the edge of the tray in a thickness just slightly narrower than the compound stick. Flame with a hand torch until all seams or sharp contours have disappeared. Then temper in the water bath for several seconds. This will prevent burning the patient. The hot water bath is set to a temperature that will keep the compound soft for an extended period. Once tempered, and if desired, the softened compound can be shaped with dampened fingers prior to intraoral insertion. Border molding is easily accomplished with the operator seated and the patient proclined. Have the patient keep their lips relaxed and use a mouth mirror to slightly retract one side of the mouth for easier placement of the tray with the softened compound. Mold the softened compound by pulling on the cheeks and lips, making circular motions, and having the patient make functional movements, such as pursing or puckering their lips. Remove the tray and inspect. Material that has been properly molded will have a matte appearance due to contact with the tissue. If the compound remains glossy, this is an indication that either the compound hardened prior to molding or that there was insufficient compound to make tissue contact. Before moving on to another portion of the tray, trim any excess compound that has overlapped the internal surface of the tray or any external material that is thicker than 4 to 5 millimeters. Blend the compound with the tray internally and externally so there are no ledges. Clean and dry the tray before adding additional compound. Repeat until the periphery is completed. When adding compound, make sure that the junctions between the molded segments are flamed to blend and eliminate any seam lines. At the posterior of the custom tray, compound is added on top of the tray rather than at its edge. After tempering, the tray is seated firmly in place.